Hello, I'm Dr. Mark Lindholm from Natural Health Family Chiropractic, and these are my lovely assistants, Sarah June Lindholm and Mary Grace Lindholm. We're going to be demonstrating some postural exercises and some stretches today. So this video is intended for the use of our patients at Natural Health Family Chiropractic. If you're just seeing this on our YouTube channel, you're not a patient at the clinic, we just want to put out a disclaimer there that you should consult your chiropractor before you begin any of these exercises to make sure that they're appropriate for you. The first movement I want to talk about is walking. Walking is a basic essential movement. Unfortunately, many of us sit way too much. Maybe you sit all day long at your job at a computer. Maybe in the evenings you're sitting watching television for several hours. So walking is super important because it really fights against what I would call sitting disease. You might have heard the phrase that sitting is the new smoking. And what they find is that sitting too much alone is really bad for our health. So the way to implement more walking into your day is to try to every 30 minutes get up and just briefly move. It doesn't mean that you have to walk a mile. It might mean at work just getting up and walking 15 or 20 feet and then coming back and sitting back at your desk if you're super busy. The ideal thing would be to walk for a minute or two. But any movement every 30 minutes is going to be helpful. One of the really important things about walking is that it literally drives the nervous system and fires up the brain. And I want to repeat that because it's so important. It drives the nervous system and fires up the brain. So it not only helps us to move to do things like condition our heart and lower our blood pressure and all those health benefits we think of actually going out and walking for 20 or 30 minutes, but movement during the day, even if it's just this brief movement I'm talking about every 30 minutes, literally wakes up the brain and helps your nervous system to function better. The last thing I want to mention about walking is that the vast majority of my patients I'm going to recommend when we begin your chiropractic care that it's very important for you to do this walking, especially right after I adjust you. I often will have people walk up and down my sidewalk a couple times before they get in their car or when they first get back to work that day, that for the next several hours they make sure they get up and walk every 30 minutes. And this is because we're really doing neuromuscular re-education. Your spine is used to being in that wrong position. And right after I adjust you, if you're walking every 30 minutes, even if it's just for a minute or two, it actually fires off those nerve pathways back and forth to the brain. It's almost like telling the brain, okay, this is the new position I'm supposed to be in. And it's going to help you, your adjustments to work better and for you to make progress in your treatment plan much faster. The next movement I want to have Mary Grace and Sarah demonstrate is just neck flexion extension stretches. So I'm going to have them go ahead and extend all the way back as far as you can comfortably, and then bring your chin back down to your chest. And they're just going to slowly do this back and forth. When you're doing this for yourself, this is especially important to do if you're in working in an environment where you're looking down, like if you're a student or if you're looking down reading, if you're doing a craft that you're looking down at, if you're sitting at a computer where you're looking down a lot. This, a lot like the walking, drives the nervous system and fires off the brain, so it's especially important to do after an adjustment. And it's especially important to do if you're in any flexed forward position to do this about ideally every half an hour. You should do 8 or 10 repetitions of this. Next, Sarah is going to demonstrate a chest stretch or a pec stretch. So you're going to find something you put your hands against. Most people would use a doorway. We just happen to be in my gym area, so she's using the squat rack. So you're going to put your hands up about shoulder height, and then you're just going to step forward with one leg and make sure you're kind of looking up as you do it so you have good posture, and you should feel a stretch in the front part of your chest. It's important that you step forward like Sarah is and that you don't just lean forward. That way she has some control with that front leg as to how deep she goes in the stretch, and she's not actually using the muscles like doing a push-up. She's letting them relax and stretch them. All right, and then you can go ahead and step back, Sarah. And the next variation of this is she's going to raise her hands up about 6 or 8 inches and then do the exact same stretch. That just stretches just a little bit different area of the pec. This is an important stretch for people to do because many people, their head is forward and their shoulders are rounded forward. So many of my patients, I'm going to have them do this kind of pec stretch. It's also something that can help with certain kind of rotator cuff problems that people might develop. The next stretch I want to have Mary Grace demonstrate is just an upper back stretch. So I'm going to have her lift her right arm up, and then she's going to grab it with her left hand or her left elbow and then just pull it across her body. This is just a really basic stretch for stretching the upper back. A little variation is she could pull down a little bit if she wants to stretch more up in her trap in the upper area, and then she could pull up if she wants to stretch more in the lower part of her mid back. Just want to hold this for about 10 seconds each, and then go ahead and do the other side also. And you would repeat this on both sides. The next stretch I want to demonstrate is a cat-cow stretch. So you're going to just get on your hands and your knees, and then to actively do the stretch, you're going to, for the cow portion, you're going to let your stomach come way forward, and you're going to actually contract your back muscles as you tip your head up, and you're going to imagine you're tipping your pelvis forward. And then the opposite for the cat portion, it's like I think of a scared cat at Halloween, so you're going to drop your head down, round your back up, and for this one you're going to contract your glute muscles. And then you're just going to slowly move back and forth between these positions. I'll often have my patients do this a number of times, so maybe 20 or 30 times back and forth. It's a really easy stretch. It's not strenuous, but it's a great stretch. And besides doing this just as a stretch for your lumbar spine, it helps to increase the lordosis. Many of my pregnant patients, I'll have them do this stretch, and we actually, you might call it, or your midwife might call it, pelvic rocks or pelvic tilts. And the advantage of this for a woman when she's at the end of her pregnancy is it actually can encourage the baby to unweight the baby and help the baby to turn into the correct position. So the next stretch I want to have Mary Grace demonstrate is just a simple low back stretch, what most people think of as a toe touch. So she's just going to bend forward as far as she can. Mary Grace is very flexible, so she can easily touch her toes. If you can't go that far, just go as far as you can. This is a great low back stretch. A little different variation on this is what I would call low back unloading. And this is a really good thing, especially if you have more chronic back tightness. So what she's going to do is that same position, but the secret to this, although it looks the same, is she's going to completely let her back muscles relax, and she's just hanging forward. You want to imagine that she's kind of just hinged, that you're hinged at your waist, and you're just letting your back muscles relax, and you're just letting them drop forward. And that's why they call it unloading. You're unloading these back muscles, not making them work at all, and just letting them stretch and hang. This can be really good if you're having more chronic back tightness to help to, in the long term, relax those muscles. All right, good job, Mary Grace. So the next stretch I want to have Mary Grace demonstrate is a hamstring stretch. And so I have her by the stairs because this can be a great way to do it at your home, where it can accommodate different levels of flexibility. So I'm going to have her start off doing, go ahead and put your left leg up on the third step there. And then you're just going to bend forward like you're touching your toe and try to shift your hips back. And you're going to really should feel that stretch in the hamstring of the leg that you're reaching down toward. At home, you'd want to hold this for about 10 seconds. The hamstrings are often really tight muscles, and that can contribute to low back pain because they attach into the bottom of the pelvis, or into the ischium, it's called, at the bottom of the pelvis, and they tend to tighten up, especially if you have a sedentary kind of a job. Now, the great thing about doing this on the steps is that it can accommodate, as you progress and you get more flexible, raising your leg up higher. So Mary Grace is super flexible, so I'm going to have her go ahead and demonstrate like her flexibility. Go ahead. So she's going to put it way up. Mary Grace is a gymnast, so she can go right into almost into the splits. So most people would probably not go quite this far, but the idea is that this can accommodate you as you continue to increase the flexibility of your hamstrings. Again, you'd want to hold it for about 10 seconds each time. So next I want to demonstrate an advanced stretching technique. This is really a cool technique, or at least for a chiropractor, it's kind of a cool technique, and it's called PNF stretching, which actually stands for proprioceptive neuromuscular facilitation. And PNF stretching relies on reflexes to trick the body into getting a deeper stretch. So it's a great technique to use if you struggle with flexibility. Say you have really tight hamstrings. We're going to demonstrate it with hamstring stretch. You can make gains or make improvements in your flexibility faster using this technique. So it basically takes advantage of a reflex trick in the body that when you stretch a muscle, then you contract it as hard as you can, and then you immediately stretch it again. You can stretch further. You only have a window of opportunity to get that increased flexibility for about 6 to 10 seconds after you do the contraction. So I'm going to have Sarah demonstrate this. So she's going to put her leg up, and she's going to do a hamstring stretch, and she's just going to bend forward. And she's going to go as far as she can comfortably with that stretch where she feels it pull, and she's going to hold that for about 10 seconds. So pretty much just the normal hamstring stretch that we demonstrated before. But now what I'm gonna have her do is I'm gonna have her straighten up, and she's gonna push down and contract her hamstring by pushing down into the stairs. She's literally trying to crush those stairs down. It's really important for this to work that you push as hard as you can, and you're gonna do this for about 10 seconds. So you're gonna count in your head 1, 1,000, 2, 1,000. All right, and then she's gonna relax, and then she's gonna instantly go into the same stretch she did before. And you're gonna hold that for about 10 seconds. And you should be able to find that with each time you contract and then immediately stretch again, that you can go a little further. As a matter of fact, this is an advanced enough technique that it can cause your flexibility to increase fast enough that it could lead to a little soreness. So I would recommend, if you're doing this, that you only do like 10 or 15 repetitions and only do it once a day for most of my patients. So, I mean, you're not gonna harm yourself, but I don't want you to be walking around with really sore hamstrings from overdoing it. The other thing I want to mention about PNF stretching is I only use the hamstring stretch as a demonstration, but you could do this with any exercise. You're just gonna stretch the muscle, contract the muscle, and then stretch it again. Now, a little trick with this is, say you were doing a stretch of like your lower back. What you could do is do the lower back stretch, like bending forward and doing the stretch, and then you could contract your core muscles, almost like you're protecting yourself, like somebody's gonna hit you, or like you're pushing, straining. You're gonna contract those muscles for about 10 seconds and then do the stretch again. And it'll lead to the same kind of a result of increasing your flexibility. Next, I'm gonna have Mary Grace demonstrate a hip flexor stretch, or a psoas stretch, which is the name of the muscle. So this is an especially important muscle stretch, because these muscles often tighten up from sitting because we're in a flexed position. And that's what this muscle does, is if you were standing and you were to march in place, it's the muscle that would activate to raise your knee up. So what I'm gonna have Mary Grace do is first get in the preparatory position. She's gonna bring her left foot forward, and she's gonna shift her hips forward, which she did, which is perfect. That alone, will probably start to feel the stretch on that right side, which is the side you're going to be stretching. But then to enhance the stretch, if you don't feel it, she's going to push back with her arm against her knee, or you could do this next to a chair or something and push on the chair to push her shoulders back, and that's going to intensify that stretch of that right side. All right, you can relax, Mary Grace. But this is a stretch that's very important to hold for more than 10 seconds. You should hold this for a minimum of 30 seconds. Many times it can be an advantage to hold this for a minute or two. So you're gonna hold this a long time. You're gonna breathe as you do it and just concentrate on sinking deeper into the stretch as you hold it. And the reason is these muscles are very resistant to stretching, and they're also very strong muscles that have a big mechanical advantage. They actually go from the front of the hip back at an angle toward the spine. So they connect directly into the spine. So if one side is tighter than the other, it really can cause spinal problems or misalignments in the spine. So for many people, this can be a really important stretch. Most people would have them do this on both sides. Occasionally, I might have checked a patient and told them that they just need to stretch one side, or stretch one side more than the other. All right, the next stretch I'm going to have Sarah demonstrate is a glute stretch, or in yoga they call this a pigeon pose. So she's first going to cross her right leg over, kind of like half of a sitting Indian style or crisscross applesauce, and then she's going to come forward just onto her hands, and she should be feeling that stretch in the right glute. If you don't feel it yet at that point, then she's going to drop down onto her elbows, which will just go further into the stretch. And in any of these positions, she can rock her hips kind of side to side until she feels the stretch more, and that's the position you want to hold it in. And then if she doesn't feel it this way, she can go ahead and lay all the way over her leg like that, which would be the most advanced version of this stretch. A really important thing about this stretch, no matter which version you do, is that you want to not hold this stretch just for 10 seconds. This is a stretch a lot like the psoas or hip flexor stretch that you want to hold for at least 30 seconds, probably more like a minute or two. And for this, the reason is that the glute muscles are some of the biggest, strongest muscles in your body, and so they really require longer than that to stretch. So it's important as you're holding it to take in some deep breaths, and with each exhalation, concentrate on going deeper into the stretch. So the first spinal exercise or strengthening exercise I want to talk about is something called Brugger's exercise. An epidemic problem with many of my patients, or many patients just in general, is a forward head posture and a flexion dominant posture. So this exercise helps to open up your posture. And I'm going to have Mary Grace demonstrate kind of one version, and then Sarah's going to demonstrate another. So the basic Brugger's exercise is that you hold your hands up and then you rotate your palms out as you pinch your shoulder blades together and then down, and then you tip your head back at the same time. And normally you'd hold this for about 10 seconds or so. It'd be a great exercise to do throughout the day, especially if you're sitting in any kind of a forward posture or sitting at a computer looking down, or if you're a student. It's very important when you're doing this, Mary Grace, can you demonstrate it one more time, that your shoulders should not come up toward your ears, but your shoulder blades should come down and your head should go back. So you're opening up your chest. And this is really an isometric exercise. So she's contracting the muscles to pull her shoulder blades back while she's pushing her head back. So that's why you want to hold it for about 10 seconds. You're actually strengthening the muscles in the back as you're stretching the muscles in the front. And this will help to encourage more of the forward arc or lordosis in your neck. Now, a more advanced version, Sarah's going to demonstrate where you can use some kind of a resistance band. She's using some resistance tubing, but you could use like a TheraBand, kind of a elastic band. So she's going to do exactly the same exercise, except she's just going to be holding on to the band, so she's going to have extra resistance. So tip your head back, pinch your shoulder blades together and down. Perfect. And same thing, she'd hold this for anywhere from a couple to 10 seconds. And it can be beneficial to do this 6 or 8 or 10 times in a row. But often people can get a lot of benefit from just doing 1 or 2 repetitions, but doing it frequently throughout the day. So this is a good exercise to set a timer and like every half an hour when you're working to stop and do 1 or 2 of these throughout the day. All right, the next strengthening exercise I want to talk about is probably the most important exercise for core strength or for spinal stability. If you only had time to do one exercise, the plank exercise would be the exercise you'd want to concentrate on. So we're going to show several different versions. The first version Sarah's going to show is what I would call the modified version. If you've never done planks before, then you should start with this version, because this exercise looks deceptively simple, but it's actually challenging to do. So what Sarah's going to do is get into a plank position with her arms elevated on this. She's using a workout bench, but at home you could use your bed or your couch or something. The higher that object is, the easier it's going to be. You want to think of holding a plank position like think of a plank of wood. So your back should be straight, your chin should be up, you're on your toes, and you want to try to hold that position for a minute. If you start to feel shaky, like she's starting to shake, you can bring one knee up and just rest for a second or so. But then go back and try to complete the minute, even if you have to rest more than once. Your goal, though, is to be able to hold the minute nonstop and feel fairly strong and not shaky. All right, great job. So Mary Grace is going to demonstrate a regular plank. So we showed the modified version before with your arms elevated. A regular plank is doing it with your elbows on the floor. So go ahead and get in the plank position there, Mary Grace. So it's important that your back is straight. Think of it like a plank of wood, and ideally you want your chin up a little bit more than that. And you're just going to try to hold that for a minute. If you can hold that for a minute, that's really good. That's what your goal is, to work up to that. And you really just need to do 1 minute once a day. Okay, you can go ahead and put your knee down and rest for a second. Now a very advanced version is eventually to work up to trying to do 3 minutes. So you're going to hold the regular plank for a minute, and then you're going to lift up one leg for 30 seconds. Hold that for 30 seconds and then put that leg down, and then you're going to raise the other leg and hold that for 30 seconds. And then you're going to put that down and then raise one arm for 30 seconds. And then put that down and then finally raise the last arm for 30 seconds. That'd be a total of 3 minutes if you do all of that together. If you can do that, you are a plank rock star, and you're going to have really a rock solid core and a really stable spine. The next strengthening exercise I want to show is a strengthening version of the cat-cow stretch. So Sarah's going to go ahead and get on her hands and her knees. And it's really exactly the same as the stretch version, except at the end of each movement, we're going to contract the muscles. So first I'm going to have you drop your stomach forward and tip your head back. And what she's doing in this position is she's actually contracting her low back muscles, like trying to pinch her lower back together. And then you're going to drop your head down and raise your back up. So for the cat portion of the exercise, she's contracting her stomach muscles as she's doing it. And it's a real subtle exercise, but it's a really good exercise for strengthening your core while at the same time adding flexibility to your back. So it would be, in this position, she'd be contracting her stomach. She'd hold it just for a second or two, and then she'd go into the cow portion. She'd contract her back, hold that for a second or two. The next strengthening exercise I want to demonstrate is Mary Grace is going to show us how to do a swimmer exercise. And then the more advanced version of that is going to be a Superman. So you're just going to lay on your stomach, And you're going to lift opposite arm and leg. And just going to hold it for a second or so, so you don't have to hold it that long. And then put it down and then raise the other side. There we go. And this would be the beginner version. You're going to do that about 10 or 15 times on each side. And then a slightly more advanced or an intermediate version is you'd raise opposite arm and leg, but you'd kind of flutter it like that for about 10 seconds. Then you'd switch and then flutter the other side for about 10 seconds. And then the most advanced version is you do a Superman, where, go ahead and do a Superman. You're going to raise both arms and both legs like that. And then you're going to bring them down to rest. And then go up and then do a new version. Go ahead and do it where you really arch up. There you go. That'd be the most advanced version. There you go. Good job.